most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This is the third video in a series. We did 3 videos on the frozen shoulder, and this is the third one. It's a step-by-step exercise and pain relief program, and this is for the unthawing stage.
The final stage.
The final stage. The first stage is the freezing stage.
Mm-hmm.
Next stage is the frozen stage. This is the unthawing stage. This is the one where I think you really can make the gains. I mean, because you're coming out of it, and this is where you can get a little more aggressive.
Right,
So,
and if things are going in the right direction, it's you can see the light at the end of the tunnel.
right, pain and stiffness are starting to go away, and so it's basically the same exercise that we did for the frozen stage. You can just be a little more aggressive about it.
Sure.
So why don't we start with the Booyah Sticks, Brad? Good thing I got the quick hands. All right, the first one is kind of more of a posture one, but you take the stick. Now, you don't necessarily need a stick, by the way. You can do this with a broomstick. I should have done it with that today, so just to show people you can.
Right. Well, with this one, you might be able to use a cane if it's a longer cane.
Yeah.
But you just need something about 1 inch in diameter and
So
4 or 5 foot long.
This is just a great one to start because posture is always just very important no matter what shoulder problem you have.
Yeah.
So you're sticking it up into your mid-back. You're grabbing it with your elbows, and you're squeezing back, so you're extending your back, but you're also doing a chin tuck while you're doing this. 1, 2, 3, 4, 5. I like to do just in increments of 5. 1, 2, 3, 4, 5.
Make sure you breathe, relax.
3, 4, 5.
Bob's sounding a little stressed over there.
Yeah. You can do this as many as 10 times because I'm going to keep everything at 10 just to keep it simple.
Boy, it varies. Like if you move the stick up a little bit.
You can move it up a little bit to get a different part of the back there.
You'll feel that. So you're actually treating your back in a sense and working your posture.
You are, because we did another video on this. If your shoulder blades are out of whack, your shoulder's out of whack. It's as simple as that. So, next one, the progressive Statue of Liberty.
Ooh.
So you're going to do it in the chair, Brad.
Sure.
And I guess I can do it kneeling.
Yeah, there's no reason why you can't.
So,
I mean, your stick would have to be taller if you're doing it standing.
Right. Or you do it on a countertop. I could do it on a countertop over here.
It's relative to how tall you are compared to your stick.
I think, Brad, I'm going to do it on the countertop.
Oh, yeah.
Yeah. So I can just go like this.
Going to hit the ceiling.
Well, a little bit.
All right, yeah.
But
put a hole in the ceiling.
So,
all right.
So we're
Can
all
you get
over
both
here.
of us?
Yeah.
Okay, then.
So, Brad, why don't you show just starting off? You're going to be the best.
Yeah,
one
so
to do.
you can start it on the floor, get it vertical about at your foot level. You can see where I'm at. That varies from person. And then you grasp a hold of the stick, and that's going to stay there. And then you just lean forward, and you'll stretch. You're getting a little traction, a little flexion, and it works out very well, and it's very controllable by you.
Now, we call this progressive, Brad, because initially you may be down here.
Right.
You
yeah.
reach up as high as you can to start off with.
Yeah.
Because a lot of people's shoulders, especially if you have a frozen shoulder, you're only going this high. Yeah, Brad's going to start at that level, comfortable level, do a few like that, and then maybe work his way up a little bit and do it again. And keep going until you can't go any further.
Yeah, when you get to the top, you can grab it like this, but
Sure.
when you're that far, then you're going to put it on the chair right here. And this is where you really need something that has like a rubber tip or something that's not going to slip. Otherwise, this will not work.
If you take the broomstick, you might tape some tape on the bottom, maybe like duct tape. Might help hold it. I know one lady said it worked for her. So.
Yeah, you may have to, go to the hardware store and figure out something there.
This
possibly.
is a great exercise. I've had so much luck with this one, with so many patients with just even arthritis, but it's such a good, it's giving traction to the shoulder while stretching it. So it's really one of our go-to ones. So these first 2 exercises that we just did, I'd keep doing those.
Sure.
This third one now, that's the one that's going to change depending on how you're doing. So the next one is the third exercise. You're going to do extensions. So let's say this is my involved shoulder.
Mm-hmm.
I'm going to put this one palm down, this palm out,
Yep.
or palm in, palm out, and I'm just going to start working it back like this.
So if you look from the back side, you're trying to keep it behind you, not out to the side.
It's not like rowing a boat completely, because you're not going like this, right?
That's paddling a canoe.
All right, I don't know any difference between this. I'm up the river with
a
up
paddle?
the creek without a paddle.
Yeah.
There we go. So you're gonna again take this to the point back where you can tolerate it. We don't push into pain much. We should have said that with the first one too.
Right.
We really don't want much pain. You can bump up against the pain, but back off of it again. We're not trying to increase pain here.
Yeah, if you get so aggressive with it, you may just make it sore the next day or even later on. So you will learn even within a day or two how hard you can push it.
So right now we're doing the posture one, we're doing the Statue of Liberty one, and we're doing the extensions. Let's say the extensions start going pretty well. You're almost equal to the other side. Stop that one. Now you can start this next one. And this is shoulder internal rotation.
Ah.
So on this one, I'm treating this one right here. So this is palm out.
Palm out here.
And this is palm forward. And I'm just going to slide up like this. I'm going to hit the ceiling, Brad. Now, a lot of people, they're going to be down here to start off with.
Right.
And they're just going to work it in here. Same thing as pain allows.
This really is helpful if your stick is smooth and shiny, then it slides against your clothing.
Yep, works out real well.
Yeah.
All right, you're going to show it with the belt, Brad?
Yeah, so you can also use a belt. I like to just loop it like this so you got like a slip knot. And I'm going to put that around the wrist. It works best if you don't grab it, because when you grab it and tighten down, your wrist muscles tighten, and then your shoulder gets a little tighter as a result. So this is the only tricky part is
trying to get set up.
Yeah,
You
there.
have to have somebody else help you out.
So you may start here. Again, this hand is my involved shoulder. I'm going to relax it and just go up and down. A smooth leather belt works the best because it's slippery. If you use one of those cloth ones, it won't work near as well. And same thing, just bump into that tight when it starts. You don't want sharp pain. When it gets to that point, go back down. Maybe do it 5 to 10 times. That may be enough for the first time.
Yeah, and you can actually do these a few times a day.
Sure.
You don't have to just do this once a day. And you're doing 3 exercises. Remember, now we're not doing this one anymore.
Right.
Because you're doing this one. They're doing the internal rotation one.
So when you get normal range of motion with the canoe paddling,
You
then
can stop that.
Then we're going to stop that and do this one.
At any one time, you're doing just 3 exercises. The
I get it.
posture, progressive. Now, to an advanced version of this, this works pretty well for a lot of people, but we certainly don't want you doing it if you tend to dislocate your shoulders or anything like that.
Yeah,
but it's good for a frozen shoulder. Is you're going to bring it up, and you're actually going to crank it forward like this a little bit. You're going to, bring the Booyah Stick forward.
Use a strong arm. And so we're working on some shoulder extension and internal rotation at the same time. Now, you'll know when it's time for this without the stick. If this is my involved side, the stiff shoulder, if I can go up this high with the good shoulder and the other one can get pretty close to it, then it's time to do it. But if I can go up to here and I only get to here,
then you're still just doing these.
It's not ready yet. Yeah.
But this really moves things along. I really have, I've really helped me, to be honest with you, when I had shoulder impingement.
Right.
So.
But this is aggressive. If things are going really well.
Yeah, you don't necessarily have to do it.
You may not be doing this one, particularly if you're doing everything functionally and things are going pretty good already. You can reach behind your back to tuck your shirt in, get your wallet out.
And if that's going pretty well, you can stop that exercise.
Right.
You're still doing the progressive Statue of Liberty. You're still doing the stick under the shoulder blade. And now we're going to add this one, Brad.
Sure.
So we're going to just work on flexion. Now you do this on a bed, or I guess you could do it on a floor too.
Sure.
We're just going to go ahead and you're going to use the non-involved shoulder to help the involved shoulder. So let's say this is my bad shoulder. This is my good shoulder. I can use it to help lift it over and try to get full range here. You might only be able to go to here to start off with, and that's fine. Just work in that range. And the closer you go together, the more this one can help.
So he's saying as your hands get closer together, the strong one helps a little more, has a
Yeah.
little more influence.
And as you go along, you can go further apart if they're both working. And once you start getting down to this part, then you can stop doing this exercise.
Sure. Hey, 5 to 10 reps at a time, probably.
Yep. Same thing.
Yep.
10 repetitions at a time.
Yep, that'd be a good.
And Brad, you want to grab the towel and we'll do the last one, the wall
Sure.
slides on the.
Sure. And again, I just wanted to emphasize, because some people, maybe older people, if you can reach into the cupboard and you can get
You
dressed.
may never get to that point.
Right, you may not have to do some of these advanced
Right.
ones. You don't have to do them if you're feeling comfortable. There's no pain, and everything you do throughout the day is fine.
Yeah, if you feel some people, that's all the farther they're going to have to get.
Right,
They
right.
aren't going to have to get up to here. I mean,
If you're a younger person or you're active, you're playing volleyball or
yeah, you got to get it
softball or
back.
baseball, then you're going to do these more aggressively. So hopefully you can. I just got a towel. We got white on white, so my hand is right over the towel, and you simply slide the towel. That's the only reason the towel is here, is so
Give
that
a little
it's-
resistance.
Yeah.
Yeah.
You can slide, but there's a little resistance, and then you can lean into that.
Yep.
If you're ready for it. You feel a little stretch pain, but no sharp pain, give it a little more. If it gets sharp, back off and do 10 of those. And again, I would say 3 times a day is probably the most.
Yeah, and so again, you're doing 3 exercises 3 times a day.
Right.
You just, as one goes well, you eliminate it and you go to the next
Right.
one.
It's progressive.
So remember, we got a PDF program along that you can print out along with this, so you can follow along.
Right. That's so nice with these exercises. So you're doing them and you can look at them and you can decide which 3 you want to do.
Yeah, just go to bobandbrad.com, go to the program section, go to the shoulders, find this video, and you can print it off. So,
Voila.
all right.
Good luck.
Thanks.